Welcome to the inaugural episode of Doctors of Animal Kingdom. We are delighted to have the privilege of sitting down with Dr. Samuel Pushparaj, a esteemed distinguished veterinarian, virologist, whose journey started from the halls of Madras Veterinary College, where he earned his bachelor's degree, to the expansive campus of Oklahoma State University for his PhD, and later to the prestigious Washington University School of Medicine for his postdoctoral studies. First and foremost, Dr. Pushparaj, how are you today?
I'm good, Aman. Thank you so much for the invitation. Happy to be here.
Thank you. What it's like, how it's like to be a scientist.
Sure. Having come from a background of veterinary medicine, it's good to be a scientist where I can make an impact on people's life. Even in during practicing medicine, we do impact, people's life in terms of taking care of the pets and also the animals who like livestock and everything. So it's a different way of making an impact on people's life. And it's a honor to have the role as a scientist in biotechnology and continue to do, what we are called for. So happy to be here.
Okay. Oh, it must be an exciting job to be in the lab playing with the viruses, I guess.
Yeah, I wouldn't call it playing with viruses. Yes, it is definitely an important job in order to, make drugs, to make a change in people's life. We as a company work with infectious diseases, and our mission is to make a world without infectious disease. And I'm kind of doing a small part of doing in working towards that. It's definitely fun. It's more exciting when you see the data and how science drives, the journey of making an impact in people's life.
Indeed, indeed. So, what ignited this passion of you for both veterinary sciences and virology? Was there any specific turning point or moment that you set on this path? What it's
Sure.
like what was your thoughts when you were
Yeah.
starting
Yeah.
out? What was it feel like when you were
Hmm.
standing at
Hmm.
the on your first day standing at the gates of Madras Veterinary College? What was your thought? What was that thing in your head? Ki now, yeah,
Sure. Definitely, I'm happy to talk about my journey to the vet school. Um, for people who are trying to, connect or resonate with me, I was born and raised in Chennai. Um, you know, so back in school days, biology was my favorite subject. And coming from India, most of the mindset is either to become a doctor or an
engineer or
engineer,
doctor.
right? So
Yes,
that's how. I didn't have any pressure from my family. So I was more interested in biology, and that kind of drove me to, like, pursuing a degree in science. And of course, like, I was, um, looking for, getting into the medical school and other things. But I'm definitely lucky to have chosen veterinary medicine. There were a few decisions that led me to there. Um, and to be honest, yes, I love animals, but it was more on the science that drove me to veterinary medicine. Um, and of course, audiences here might mostly be like veterinary students trying to understand and look for opportunities. Um, but back in vet school, it's kind of a rigorous curriculum, right? From day one, you are given a task, and you just run behind it. So the 5 years just flew by fast. um, I didn't have any clear opinion on like what would be my next steps. But during that process, probably few teachers made me an impact or inspired me to focus on few areas in science. And one was microbiology, and the other one was like public health. I was also interested in like gynecology a little bit. Um, so I had a few different options. But so during my vet school, they had a program where, they had to, like, the top students had an opportunity to go to the United States for a clinical externship.
okay.
and I was not on the top list, but some of the people who are on the top, they didn't take that opportunity, and that kind of came down to me. So that kind of opened the door to come to the United States for a clinical externship for 6 weeks. So that was my first time coming to the States, and what I saw here is the potential opportunities to do quality science. Even though I was, veterinarian, I did practice for a while, but I had more drive on research rather than practicing medicine. So I thought probably I should go back, finish my GRE and TOEFL exams, and then come back for my PhD. And I had to wait for a while. So meanwhile, I did a postgraduate diploma in zoonosis, where I worked on bacteriophages and E. coli. And then I was pursuing a master's in animal biotechnology for a while. But then the opportunity on PhD came by, so I just dropped out of the master's program and came to US for my PhD. So that was kind of my journey from vet school to PhD, and probably we can talk more about the few key points during this journey, and also after
100%.
PhD, how things changed.
Like you mentioned about it, teachers. Would you like to name a name? Any names you want to put out there?
Sure. I mean, I just want to make sure. I mean, just want to be very clear. It is not like calling out people and like relieving the rest. I mean, everyone had an impact, but I was inspired by a few great teachers who are also great scientists. One is Dr. John Kripagaran, who taught us veterinary microbiology. So, I mean, he was definitely an inspiration. And the other person was Dr. Gunaseelan in public health. So those two teachers, I mean, they inspired me to look things differently and to do quality science. I mean, I'm still in touch with these people and many more. Yeah, I mean, there are a lot of other teachers that mentored me and gave me opportunities to I mean, guide me and point out the right direction. Dr. Devi was one, Dr. Sumati from clinics was one, and I'm still in touch with these people, and and trying to give back whatever opportunities to the next generation of students.
Okay. So you said you went for a 6-week clinical exchange. What differences did you see, and what was it like? It would be wrong on my end to say a comparison, but what was the differences you saw? Like, what was the advances you saw? Like, what was the fascinating things you saw there during your clinical rotations?
Yeah, I mean, here it's two different environments, to be clear. I mean, back in India, we have a high level of caseload, so you don't have enough time to look into each and individual cases in a much detailed manner. Whereas here, the cases come by appointments or schedules, so you have plenty. I mean, probably like 1 to 2 hours of time to just look into a one case. So that was kind of a bigger difference. So here, I mean, probably it's more of a systematic approach of making observation and diagnosis, and then the treatment course. I mean, the treatment plans and all those things follows up after that. It doesn't mean that things are superior here. I mean, we have mastered the skill of making quick observations. We know what are the conditions that are prevalent. I mean, our professors have like extensive experience, so they can pinpoint things much faster than a fresher. So those things, I mean, definitely are the key differences. But I think both the systems are fine in terms of the caseload that we get. Yeah, so I don't think one is superior than the other. Both are
Okay.
functioning in a way according to the system and the caseloads there.
All right. All right. So you did a PhD without a master's degree, like you were pursuing a master's degree and you left it and to do your PhD. So this is a very unconventional route for most of the veterinarians or for any graduate in India. This may have raised many eyebrows for some. Can you shed some light on your decision making? Whether would you recommend this to aspiring scholars, or would it be to do a PhD? Would it be sufficient, or one should also go for a postdoc?
Um, in terms of um, you know after vet school, probably the ideal path for most people, what they think is like doing a master's. So what I'm about to say is just based on my experiences, and it's probably like focused more on US, not on other countries. But at least in the US, I mean, you can definitely do a PhD directly after BBSc. You don't have to do a master's. I mean, having a veterinary degree, that will give you an advantage when compared to a BS degree. So the veterinary degree is valued that much. So you don't have to have a master's. I did my PhD in a vet school. It was a comparative biomedical sciences program, but doesn't mean I did work on just veterinary related research. It was more on human medicine. I worked on influenza A virus and SARS-CoV-2 a little bit when the pandemic happened, and studied the role of link RNAs, like long non-coding RNAs, on the disease pathogenesis. So it was not just focused on veterinary medicine.
Okay.
For yeah, I think there are some misconceptions about you need a master's to do a PhD, and it's absolutely not. For anyone who's probably thinking of doing a PhD, probably they should have their like CV ready and like maybe a cover letter. And there is also a misconception, so like miscommunication and assumption on having a research proposal ready. I mean, in most departments, I think the PIs will have what I call as PI guides in our term. They have existing projects that will be assigned to students based on their interest, and they'll take care from there.
All right.
Yeah, so you don't have to write a research proposal or anything like that.
Okay. So you'll be like working under a guide on his project. One can say on his or her project. One can say.
Yes, yes. I mean, it depends on where the funding and what kind of projects they have funding on. They are liable to the funding agencies too. So based on the project funding, they will probably work on that. And if it's a bigger project, it will be broken down into smaller projects for to be given to multiple students.
Okay. And is this true? Like most of the PhDs in US are fully funded.
Mostly, it is true. Most of the PhD programs comes with a stipend, and so that will partially cover the tuition costs. So, and different colleges might have different terms, but you will just be the course fee, which is kind of around $100 to $150 or $200 per credit hour. Here, I mean, for each semester, a student is required to take 6 to 9 credit hours. So here in the US, it will be kind of 3 semesters, like fall, spring, and summer. So based on that, for each semester, you'll take either 6 to 9 credit hours, and the course fee is based on that. But whatever stipend that you are being paid, it should mostly cover the cost of living, and also you should be able to pay the tuition fees, and probably, I mean, depending on the lifestyle, you can save some as well.
Okay. Okay. Thank you for clearing this big misconception of research proposal and about telling also about this fully funding of the PhD in USA. Okay. Now coming to the One Health aspect of life, what are your thoughts about One Health, and as you are working with the viruses, not only veterinary but also humans also, so you are a perfect person to answer about One Health concept. So what are your thoughts about this? What do you think, and how does you impact One Health? How does you add to One Health?
Sure. I think, the concept of One Health is more focused on zoonotic medicines as of now. Um, whatever medications that we give, in most cases, it's probably the same medicine for humans and animals, right? Just in terms of the dosage, it's going to be different. But other than that, the mechanism of action, it's kind of similarly going to, mostly in most cases, it's going to be the same. We I think we focus a lot of like prevention and transmission of zoonotic pathogens, but that in terms of research, it's still through like two different entities, like whatever companies, they focus on medicine. It's either on human medicine or the animal medicine. There are companies here in the US too that focus completely on like animal medicine. So still there is a gap between these two fields, but it's more focused on disease prevention and how we can avoid the spillover of the infectious diseases. I think there are some. Uh, Again, it depends. The laws are different on different countries, but I think there are differences on how the wet market and how the market and structure is there. So all those differences, has to be taken into consideration while thinking about those two, um, you know, aspects of One Health medicine.
With this respect of One Health concept, antimicrobial resistance is also a big issue with medicine. So, have you ever encountered during your research working with viruses anything, and what are your thoughts how one can control this AMR in medicine? And one of the example is of Nimesulide in the Indian subcontinent. Many cases of this Nimesulide has been reported during the pandemic in vultures. So, what are your thoughts
Hmm.
on
Hmm.
AMR?
Yeah, that's definitely a good question. I think it starts from some good practices from veterinarians and also physicians. Um, Often we don't test for antimicrobial resistance when a patient comes in, right? We don't do swabs or cultures to look at the, what to pinpoint like what kind of strain it is or what species it is, and then try to figure out like um, what kind of antibiotics it is responding to. And probably it's not possible to do for every individual cases too. So we would, probably like veterinarians might like prescribe a common antibiotic that either it's not relevant or might be a broad spectrum antibiotic. And over time, they're going to gain. We're going to lead into superbugs. So I think it starts from good practices. Um, in terms of, viruses, yes, there are some resistance. That's, viruses show too. There are some escape mutations, but in terms of, making a mm, medicine, those things are considered before a medicine is put into a clinical trial or into the market. Um, but there is, the concept of virus evolution, right? So it's kind of whatever we try to do. Definitely, the virus is smart enough to get escape and
Yes.
mutate and gain resistance. I think that's kind of a constant challenge that we have to face. Uh, but in terms of, as veterinarians, probably we have to be conscious about what kind of medications we give the patients, in order to avoid things like this.
So, as you were talking about the viruses and the mutation, can you explain a little bit more about the mutation?
Sure. I mean, I'm not an expert just studying on mutations, but I've worked with pathogens where we test different sequences that has different mutations. I mean, at least for my PhD, for influenza, I mean, we do definitely test like different strains, like for H1N1 or H3N2, the Wisconsin strain and other things, influenza B. So those are things that I've personally worked with during my PhD. In terms of things that are contributing to the mutations, I mean, there's a lot of factors. I mean, especially for influenza, it's kind of swine or pigs serve as kind of the intermediate host, right, where the recombination happens between like the human species and also the avian species. And of course, I mean, we as veterinarians play a vital role on managing all those. Yeah, I think probably here in the US, there is a lot of sequencing studies going on. That constantly there's surveillance of what strain that are being in the circulation and things. I don't know much about India, but I think we have to be good on like the surveillance on what strains that are circulating, and then also make sure we have some preventive measures or plans to contain any highly resistant strains.
Okay, okay. So, as you have done your like you are a virologist, right? It comes with a fair share of challenges. Can you share what significant obstacle you faced during your PhD and postdoc journey? And can you just a little bit elaborate how one can deal with it?
Sure, I think the biggest challenge coming from veterinary medicine background, and also coming from India and to do a PhD or a higher education in a foreign country is, I mean, if you're willing to adapt and learn quickly, I think you'll be fine. I mean, for someone who has gone through that journey, I mean, that adaptation phase and, learning the new disease, like infectious disease or like disease area, is kind of, there is a learning curve. It's not, I mean, if you have the curiosity and if you are enthusiastic to, make that transition, probably I mean, you need some time to settle down and like be exposed to the new area that you're working with. And most often, I mean, labs and guides or PIs, they give you some time to get to know, like, be familiar with the field. And there are courseworks that you can take related to the science that you work with, as well. So I think if you're willing to learn, I think you can easily bridge that gap of not being familiar with the field to being an expert on the field.
All right. Okay. So now, as we also were discussing about viruses, I want to know what's your point on COVID-19. You are free to deny. You don't have to comment if you feel like you don't want to comment. I totally understand this. This is a very controversial thing. I so
Um, can you be specific on like what's my point? I mean, meaning the origins of the virus,
was
or?
COVID-19 was made in some labs, or like some it has been some tweaked, because in
Mm-hmm.
India, in a lot of places, people abandon dogs because of coronavirus, because as dogs do get coronavirus vaccination. So is there any correlation between COVID-19 and COVID virus, and what are your thoughts on it? Was this COVID-19 was changed? in the lab, or it just happened in nature? What are your
Um,
thoughts on this?
I'm not definitely an expert on these speculations or these origins, but I mean there is definitely an investigation that went through, and then I mean I think the final report was it was not based on a lab origin. I mean that's kind of the I mean that was an extensive investigation that was done. So I don't think yeah, I think probably it's good to stop it there. Um, but in terms, I mean, there is the virus is constantly like there's an evolution happening with the virus. I mean, we all know that. Yeah, so and that's something um, you know I think everyone is monitoring actively. I mean, cases are rise in the U.S. and also in India too. So I think we have to do our part on preventing the transmission.
100%.
Yeah,
Be it any
by
disease,
getting
be not only COVID-19, all other diseases which requires a transmission, which requires a host, a medium to transfer, we can
hmm
do our part.
yeah. At least for COVID-19, I mean, getting vaccinated is the big thing for now. Yeah, if we can have some immunity developed against the existing strains, that would be better, I guess.
Okay. I guess we can take questions now. What are your thoughts on it?
Sure. Yeah, I'm
Okay.
happy to do.
Okay.
Yeah, I think we have one question in the chat. What are the question is
Two
what are the possible
questions.
two questions? Yes,
Yeah.
I think it's from the same person.
Yes.
Yeah, do you want to go through it,
Yeah,
Anand?
yeah, I'll read. What are the
Okay.
possible ways to get a fully funded PhD in US? And are there any channels or organization like DAD, which works from Germany, which helps to cater these requests? Any suggestions will be helpful.
Sure. I think most of for addressing the first part of the question in a possible ways of getting a fully funded PhD program, I think most of the if you are accepted for a PhD program in the US, it's usually a fully funded program. I think it's not for master's program. I mean, there are master's programs too. For masters, it is not that case. Usually, people who come in probably may have to pay for the entire fees for the first semester, and based on their
Financial
scores
background.
on the performance on the first semester, probably yes. And based on the performance on the first semester, probably they might have opportunities to apply for funding within the school or the program. But for PhD, it's usually a fully funded PhD program. The stipend is given by the PI, so they usually recruit students only if they have funding. So there are two tracks. So one is kind of called the graduate research assistants. That's completely like research and not much focused on teaching. But being a veterinarian, if you come to a vet school, you have the opportunity to assist in teaching like the veterinary students here in that program. So that's kind of called a graduate teaching assistant. So in short, we call GRAs and GTAs. So GTAs are usually funded by the program, the school, because they're teaching the students, right? The GRAs are usually funded by the lab that you work with, and in some cases it can be a combination of both, like 50% GTA and 50% GRA. So these are the options. When you receive an offer, they would tell you whether you're going to be a GTA or a GRA, and having a veterinary background will definitely make you fit for both of these. So usually it's mostly a fully funded program. In terms of any channels or organizations that can help with this, I personally am not aware of any specific organizations that can help in a broader perspective in the US, but there are definitely organizations within different schools that can, um, you know, highlight the open opportunities. I would say if you are interested in doing a PhD in the US, I I would ask you to reach out to like already like PhDs who are already in the US doing it, and if you have some mutual connections, that's the best way to reach out to someone like your senior or someone who's from the same schools, and they can help you or guide you. um, at least personally for me, that was my journey. I mean, I had an alumni who was a faculty, and he didn't have an opportunity, but he kindly referred me to another lab with whom I did my PhD. So it was kind of those mutual connections. So I think networking is important. At least we back home in India, we I mean we're not being taught on the importance of networking a lot. I think
Yes.
it starts from your college. You have your seniors and juniors and everyone else, your faculty members. So I think if we can find people who have some mutual connections on LinkedIn and try reaching out to them and asking for um, any opportunities that they are aware of, they can definitely be happy to help. Yeah, so those kind of are the channels that I utilized, but there are not any specific organizations that I can recommend.
So now the second question is, what could be the good research topic or proposals that a final year student can work on?
Um, yeah, I think it's a good question, but what I would say is work on something that you're interested in. I mean, just because there are opportunities, if you don't like that topic, just don't go into just because there is funding for it. I mean, if you really value something and if you really have an interest on something, pursue something that is related to it. I mean, projects at the vet school level, I mean, you will be exposed to the critical thinking aspects and also learn technical skills, and that's kind of your takeaway. You don't have to stick on with the same topic for your entire career. I mean, as long as you have shown um, like that you're able to perform good research, and you can prove this using, I mean, publications if we can. That would be nice. So just focus on gaining more skills and also work on like topics that you're interested in. And at the vet school, I mean, there are only limited topics, right? There is not a lot of, I mean, you cannot work on cancer research or anything like that. And I mean, still, I mean, cancer or oncology is a hot topic, right? Um, so just don't go behind the topics. I would say just stick on with what you're interested in. Yeah. So in terms of yeah, I'm not very familiar with the policies on like Europe and Canada, but for at least in the US, if you want to practice in the US, the program that that we do in India, I mean BBSc, is not considered to be a DVM degree in the US.
Yes.
It's considered to be a DVM equivalent. So in order to practice in the US, you have to come to the US to do a 1 year rotation in a vet school. And after that, you have to clear the licensing exams, which is called NAVLE. So that has to be cleared for you to be eligible to practice in the US. It is usually an expensive process. There is no scholarships available for this. So if you're financially capable of doing that, that might be the way to go. And then I mean, I've heard that it can be a challenging exam to take, and it is an expensive one too. But you have to get that cleared in order to practice in the US. But after that, the challenging is like I think there are opportunities for a lot of opportunities for veterinarians here in the US. There is definitely a shortage of veterinarians, so there's definitely job opportunities here. But as an international, you have to navigate the immigration process, and especially for people who are from India. I mean, the green card process is a long journey. So if the company can sponsor you green card, that would be nice. Otherwise, you have to go through a work visa, and those things can be challenging. But yeah, so this the
Right.
phase of doing a 1 year rotation and then navly is kind of the hardest part. And once you figure that out, you'll have job opportunities here in the US. I'm not very familiar with Europe and Canada, but they do have some licensing exams similar to here. If I mean, for someone who is interested in that, I can definitely, if you can connect me with me on LinkedIn, I can, you know, make some introductions to people who are in Canada that I know of.
Okay. For Canada, one also has to write NAVLE. You will have to register with the CVMA,
Okay.
that is Canadian Veterinary and Medical Association. And for UK and
Mm-hmm.
for Europe, that is the RCVS, Royal College of Veterinary Surgeons statutory examination. You'll have to write if you want to practice in UK. I guess I have
Yeah.
questions.
Are there any other specific questions
Yes, a
regarding
lot of questions related
opportunities?
to veterinary microbiology we got.
Okay.
So, is PhD popular in US for veterinary microbiology students?
Um, Here in the US, it's more the program is not very specific for microbiology, but it's usually called biomedical sciences program. So that's kind of a popular program where having a vet med degree can help you to get admission. But there are like other programs where specifically focused on infectious disease or microbiology, but the biomedical sciences program is kind of the popular one. Yeah, that's probably more suited for veterinarians.
Okay. And another question is how one does set themselves up for a transition from academia to industry?
Making a transition from academia to industry, at least in the US, there are few things that you have to navigate. The first thing is, I mean, obviously, like finding a position that suits you based on your skill sets. So one thing when applying for a job in industry, it's usually a resume, which is kind of just 2 pages, and not actually a CV, which is usually a multi-page document. So that refining your resume is important. And the other thing is networking is key in order to make a transition to industry. So if you can find people that who can refer you to a position in industry, that would be great because that reputation, that credibility values a lot. And do something when you're in a vet school or in your PhD, rather than just being focused on your training in terms of doing the research, do something a little bit beyond that, like get some leadership skills and show some transferable skills. And it can be part of like organizing a meeting or being a member of a grad student association or things like that. I think those things are valuable in terms of setting you apart in order to make a transition to industry. So those two are probably the key points that I would say that you can set you apart from the other candidates, and also to make a transition from academia to industry.
Of this, what is the scope of microbiologist in abroad? Seems like people are much
Yeah,
more interested in microbiology.
yeah, yeah. Here, I mean, I mean, technical skills are more important in terms of, I mean, it's not just you have a degree from microbiology, no one is going to give you a job. If you have technical skills and if you have good transferable skills or interpersonal skills, I think those are valuable. In terms of scope, yes, there is a lot of opportunities both in academia and industry. If you have a degree from biomedical sciences or veterinary like microbiology in general, for academic careers, usually people will do a postdoc and then try to get into an assistant professor job. Yeah, and that's probably kind of a longer journey. But if once you have a PhD, and if you have good skills, and if you can tailor your resume to the job description and apply for jobs and also look for references, I mean, you can join as a scientist in any pharmaceuticals or biotech company with the microbiology degree and all the skill sets that you gain through that program.
All right, all right. So, what advice would you give for a future scientist who's interested in virology or pursuing uh, to to a PhD or a postdoc? What resources or books would you recommend for them to go through? What are the things one should go through?
Sure. I think it's kind of summary of whatever I told just now. I think it's we are all good to be, we all come from a good trained environment in terms of practicing veterinary medicine, but try to improve your research skills and analytical thinking in terms of like doing some projects where you can show your credibility as a researcher. And once you have come to a PhD program in the US, I mean, yes, do what you have to do for graduating successfully, but also just don't stop there. Try to do something beyond that in terms of gaining leadership skills. And I think those things are valuable when it comes to working in a company, because you in the lab at least you'll be mostly working by yourself. But when you work in a company or as a scientist, you work as a team. It's not like you're focused on an individual member. It's more of a team oriented environment. So if you can work on your people skill and communication skill, that would be great. And networking is key. I would again stress the importance of networking. Most often, people are just solely focused on their degree, and they do not talk to people. I think it's very important to go beyond your lab and talk to people, gain connections, have a LinkedIn profile if you don't have one. So those things are important. And I mean, those skills are very valuable in terms of a business as well. How you communicate with clients and other things. So yeah, so those kind of my high level points on areas that you have to focus on in order to grow as a scientist, and yeah, be open to opportunities.
Okay. So, as we gaze into the future, where do you envision the trajectory of virology over the next decade? And what transformative breakthroughs do you hope to wish and contribute to? Where do you envision virology as such?
Um, I think there is a lot. I mean, there's a lot of directions that it can go to. I'm not an expert to envision this is how the field should go or anything like that. But there is a key finding that it's viral infections can contribute to a lot of other infection, like other disease states too, like either cancer or other things. So rather than just focusing on either cancer or virology and other things, I think if we can address the causative agent or like the overall like a whole therapy, combination therapy and other things, probably that would be more impactful on the patients. So I think that kind of a transformation has to happen in order to you know make a holistic therapy. um, and and there are more improvements coming on precision medicine like gene therapy and other things, so that's gonna be a big focus on probably the next decade in the field. There are still some challenges on gaining clinical trials and getting the FDA approval on all those things, uh, but still it is happening a lot here in the US. So I think those are the directions, and of course, like AI is playing a role in everything, and it has a role in drug discovery too, and that's going to be a boom in the field as well.
Where do you see AI as such? Like how it's going to impact? A lot of people fear AI, like it's going to take their job. Where do you see AI?
Um, I think, I mean, AI is smart, but it doesn't mean it's going to replace your job. I mean, it's still a controlled environment. I mean, in terms of drug discovery, I mean, instead of us manually checking for different compounds and target hits, probably AIs can through like machine learning and those things, it can definitely speed up the process and also screen for more targets rather than just the manual drug discovery process. So it's not gonna be a threat, but if we can use the power of AI to utilize on whatever fields that we are working with in a more controlled way, I think it's
Exactly,
still
100%.
an advantage.
Any questions we have? Any audience? Will be ending the session here. Any questions? So, to end this engaging conversation, please, Dr. Samuel, thank you. And if you have any words, encouraging words you want to say to the people out there who are interested for in research, anything, please.
Um, Sure. Well, first of all, thank you so much, Aman, for organizing this. I mean, I know you are a veterinary student yourself, and it's tough to find time to do this. And you're trying your best to make this happen, and hope this is useful for many more people who are listening to the live session and also on the YouTube telecast. Um, I mean, just want to final words is just not an advice, but just trust in yourself, and you know learning is a process. So just give your best on it. I know the employment opportunities maybe in India are not so great, or there is definitely heavy competition for practicing medicine too. But there are definitely a lot of opportunities. Think out of the box on how you can um, you know do the best of what you're doing, and there are definitely opportunities beyond veterinary medicine in terms of like pursuing your career in research. And once you do a PhD, or once you do a PhD in the US specifically, based on my experiences, there are a lot of opportunities or doors that open up. Not specifically as a scientist, but there are a lot of other opportunities like medical science liaison, or regulatory affairs or clinical affairs, like medical writing and all those things. So whatever skill sets you have, I think it's important to realize who you are, what are your strengths, and what you like doing. I think as long as you enjoy what you do, that's kind of a good sign that you're in the right field. Um, if you don't enjoy it, probably you can fed up soon. So I would say focus on finding who you are and what are your strengths, and look for opportunities that would fit your goals. And that's where trying to connect with people and talking to figuring out what their job and how they like their job is important. Networking is important there. And then based on those information, make some informed decisions. And I think that should set you to the path of success.
Thank you so much for giving your time, your sharing your journey with the people. Thank you so much.